have a huge responsibility as a dentist in the sense that people are trusting you with their teeth, with their health. I wanted to study chemistry, but my dad talked me out of it. My parents, being Arab, they're like, no, you can't do anything with a chemistry degree. Sometimes when you get into dentistry the first time around, you're not as grateful for the opportunity that you have in front of you. The worst thing when you look at a portfolio is if it's just filled with writing. No one wants to see text. You have to remember these practice principles are busy people. You could be the best clinical dentist, but if you can't show it to people, no one knows about it. And this is where social media comes in. That's why you have to be present on social media. Otherwise, you're almost like a ghost, you know?
Today's guest is the dream associate, someone everyone wants to be after dental school. Dr. Ameen Furat, alongside being one of the nicest guys you'll meet, managed to land jobs at the best private dental clinics across the UK, working with the likes of George the dentist and other top clinicians only a few years after he graduated. Like, that's absolutely insane. From the renowned Fulham Road Dental to the famous Harley Street, he's reached incredible heights in such a short time, and he's here to tell us exactly how he did it and how you can do the same. If you're a young associate, FD, or dental student, you can't miss this one. From becoming clinically competent, building a portfolio that stands out, learning the soft skills and how to actually land the best private jobs, this episode is a masterclass in becoming a super associate. Tips, tricks, mistakes to avoid, this episode has them all. Let's get right into it. Welcome back to season 2 of The Young Dentist. I'm Fahim.
And I'm Afif.
And today we're joined by Dr. Ameen Furat. How are you doing, man?
I'm very well, thank you. Thanks for having me on the show.
Well, thanks for coming down. Just take a few seconds and explain who you are to the audience.
So my name is Dr. Ameen Furat. I'm a dentist who primarily works in London. I work for some prestigious dental clinics, which you may have heard of, like Fulham Road Dental, Direct Dental, and I also work in Oxford in a place called Taha Dental.
Interesting.
So, a question we always ask as a follow-up to that, right, is why do you do what you do? Why are you? What's your why?
Honestly, I think for me, with dentistry, it's primarily because you can genuinely be of service to people. I think people lose sight of that sometimes. Like, you have a huge responsibility as a dentist in the sense that people are trusting you with their teeth, with their health, and the onus is on us to try and make sure that we're delivering the best type of care to these people. Because if I'm honest with you, if you're in it for money, you can make more money doing other things than dentistry. And it's not worth the stress, the time, the effort. So your purpose really has to be a lot higher than just monetary gain. And as a healthcare professional, you could do a lot of good in this world whilst you're here.
So you mentioned servitude and serving, right? Why do you use the word serve?
Because ultimately, as a dentist, that's your role. It's not about you. It's about the patient. You're serving them. It's kind of like a waiter in a restaurant. That's your job. You're trying to serve food to these people. But for us, we're serving what? We're serving good quality healthcare, hopefully.
Got you.
Brilliant. And I know you mentioned there about why you kind of wanted to do dentistry, or why you do dentistry. Has that always been the case? Has that always been the reason why you wanted to do dentistry?
If I'm honest with you, no.
Take us back to the pharmacy days. You did a pharmacy degree first and then dentistry. So what was the why then? Why does someone go from doing a long course in pharmacy and switching up and going to dentistry?
Yeah. I think when I was 17, I wasn't one of those people who really knew what I wanted to do in life. And I think 17 is just very early to make such a big decision about what you want to do for many years. So I was caught in a crossroad. I was good at chemistry. I wanted to study chemistry, but my dad talked me out of it. My parents, being Arab, they're like, no, you can't do anything with a chemistry degree. So they told me go into some sort of healthcare profession. And at the time, I thought pharmacy might be a good option. I actually had the grades to study dentistry at the time, but I don't know. I never really sparked my interest in that way. So I studied pharmacy, and for me, it was a great experience because I felt like 4 years in pharmacy gave me an opportunity to really mature and, just really get to grips with what I wanted to do in life and mature as a person, you know, my personality, you know, who I was, etc. I think by the time I was in second year of pharmacy, I realized I didn't want to do this. Because it was
that early on.
Yeah, I
Why
think
not?
probably towards the end of second year. I think I realized that I didn't, with all due respect to pharmacists, and I respect pharmacists a lot, I just couldn't do that job personally. You know, for me, it was either you end up in industry, in the pharmaceutical industry, which was very difficult to get into. There were only like 2 places a year or something like that. So it's super competitive. Or you end up in hospital pharmacy, where regardless of how talented you are and how smart you are and how hard you work, you'll always be secondary to the doctors on the clinics. So even if you had valuable input. And then lastly, you work in community pharmacy, which is, as some people say, a glorified shopkeeper. Which, again, I have no disrespect towards pharmacists. I respect them a lot. And quite a few of my friends are pharmacists, actually. And a lot of them are very smart, and they could have easily studied dentistry. Genuinely, I could see so many of them would have become amazing dentists. But it's just the path you follow in life, right?
So when did that switch happen? Did you finish your pharmacy degree and then switch into dentistry?
Yeah.
Wow.
By then, I had finished 2 years of pharmacy. So I thought, okay, either I drop out now, or I just finish the degree, and then I go and study dentistry. What I did was, in my last year of pharmacy, I applied to dentistry, and I thought, look, I'm going to apply. If I get in, I get in. If I don't, fine. I'll just apply after my pre-registration year. And I remember at the time I applied to 4 or 5 dental schools. I think it was Liverpool, Glasgow, King's, and Barts. I got into all of them apart from King's. Yeah. On the last day of UCAS, that's when they decided to reply to me, saying no. Yeah.
Would you have gone to King's if you got the King's offer?
I think because my pharmacy degree was at King's, I probably would have. But actually going Barts was one of the best decisions I ever made. Yeah, one of the best things that happened to me, because, and I'll go into what happened when I was at Barts. Became like the president of the Dental Society. I was very involved in the student life at the university, and it was a nice close-knit community there as well.
We'll go into that a bit further, you know, your time in dental school, but let's take a bit of a step back. You mentioned 2 years' time between you falling in love with the idea of pharmacy and then graduating. How are those 2 years like?
The initial 2 years in pharmacy?
The second 2 years.
The second 2 years?
Liking it and you graduating.
Yeah, they were tough. I was literally just counting. It was like a countdown.
Yeah.
I was just trying to get through those years. And I went through a phase where I was really into like bodybuilding, and I was like having all these protein shakes, going gym and things like that. So I got really big, and I was doing that on the side, and I was just trying my best just to get through my exams and do as well as I can on my pharmacy degree before transitioning, hopefully, to study dentistry.
Do you wish you dropped out earlier, or would you say the 2 years, or what would you recommend to a student who's feeling really unfulfilled, doesn't have like any prospects longer term? Would you recommend to switch it straight away or stick around?
Honestly, that's a personal decision to make. Like for me, I think I made the right decision ultimately, because those 4 years really did change my mindset. Like I remember when I was studying pharmacy, I wasn't very involved in student life. I was one of those people who was like a hermit. I would sit at the back of the lecture theatre and just not want to be noticed. And people who know me now probably find that really strange. So when I went to study dentistry, I came in with a complete different mindset, because I missed out on so many opportunities, I think, just by disconnecting from people on the course and getting involved in the student life. And you want to get your name out there even as early as dental school, which you guys are doing, which is amazing. And now I feel like the competition's a lot greater. So you guys really do have to get ahead of the crowd, as it were. And we're in the digital age, which has changed a lot. Like when I was studying pharmacy, all we had was Facebook. I think Instagram was just starting at the time. And YouTube, we had YouTube as well. But it wasn't as big as it is now. We never had TikTok. We never had, all this sort of stuff. It was back in the BlackBerry days, you know,
Yeah.
BBM. I don't know if you guys are old enough to remember. You guys don't even know BBM. That made me feel old.
Sorry, man, sorry. I like it.
Yeah. That's interesting because
Yeah.
we spoke before about how even after graduating it's really competitive and how social media can be used to get ahead in that, and we can talk about that later as well. But I want to take you now to Barts. So you've just entered into Barts and you've done a full degree beforehand. I mean, what did it feel like when you were sat in that first lecture, you were looking around and you were kind of, I'm finally here now?
Yeah. I think, honestly, I was really grateful. I was very grateful to be there. I think the 4 years in pharmacy made me realize how lucky I was to be sat in that lecture theatre studying dentistry. Sometimes when you get into dentistry the first time around, you're not as grateful for the opportunity that you have in front of you. And it's what you make of it as well. So I remember within the first week, I think it was like within 2 days, you had to elect a first year representative for like the year group. And I just thought, you know what? I'm going to put myself forward. And I went against, I think, maybe 2 or 3 people at the time. And luckily, because I felt so grateful at the time, I was talking to all the students. I was trying to get to know them, a little bit of background. It wasn't with any like intention to, take on a role or anything like that. It was just genuinely because I was interested in finding out about them, their history. And I think people who study dentistry, they're all very fascinating if you take the time out to get to know them. So I put myself forward, and thankfully everyone voted. Well, not everyone, but I got voted in as the first year representative. So I was straight away put into a position of responsibility from day one of my dental degree. And then I just took it on from there. Like, it just went on from there.
So you mentioned the Dr. Ameen maximizing opportunity, right? Whilst you're in there and your second degree. What else do you do to kind of make the most of the university experience?
Yeah. I think network, get to know people on other courses.
As a student? How do you do that?
As a student. So go to like events, social events, talk to people. Don't be shy talking to people in the libraries, things like that. You see them, they've got a textbook open on, they're studying some sort of cardiac stuff. Just talk to them. Oh, you're a medical student. Get to know them. I've got quite a few medical friends as well. The other things is awards you can apply for. So there are a lot of awards for students.
Really?
Like like essay prizes.
Okay.
Things like that. And even if you don't win, just the experience of entering and you researching the topic is very useful to you. You'll learn a lot just in that process. So you can do that. You can shadow dentists if you have spare time and your exams you feel confident with your studies. Audits, you can get involved with audits. So the universities generally have, like the professors will have audits that they're carrying out on a particular subject, like you can do in root canal treatment, oral surgery, that sort of stuff, especially if you want to go into specializing, if you're considering specializing in the future. And I think those are the main things, just audits, awards, studies, network within the university, try to network outside of the university as well. There are a lot of organizations that organize student events, like the BACD. They do like a young dentist day. I remember I was in my 3rd year of university and I went to the first ever BACD Young Dentist Day in central London. That was a great experience. I remember they had Sam Jethwa there. They had, I think they had Simon Shard as well at the time, potentially. I can't remember off the top of my head now. It's so long ago.
Yeah.
But it was literally the first ever day. And I was like the only dental student there that was below 5th year.
Well, what did that let you do later on? Because I think a lot of students probably thinking, all of this audits and awards and essay competitions, how is that actually going to help me when I want to become a dentist, working with my hands? Like, how did that help you, for example?
I think it gives you a deeper insight into the dental profession as a whole. There's more than just the 4 walls of the dental school, as it were. And like I said earlier, if you research a topic, You know, that's giving you breadth of knowledge, which maybe you wouldn't have learnt on your degree. So, for instance, I remember there was an award for the ADI had an award for implant dentistry, and you're not taught much about implants, so you have to go and research the topic, etc. And that might spark your interest in implants, and maybe when you graduate, you'll consider going into that specialty once you're out of dental school. So yeah, I think those are the main things.
So I mean, you know, let's say your second or third year when you got elected as president.
Third year.
So how did that feel? You know, being the pinnacle of dental student voice at Queen Mary's.
I wouldn't say I'm the pinnacle, but
you were the elected representative, right?
It was it was a huge responsibility. You had to be really good with your time. You had to be very disciplined to balance all the extracurricular stuff with the course itself. The experience was amazing because I always think it was almost like running a business. You had this society which was composed of 20 plus committee members, and you had to manage all of them. You had to make sure all of them were doing their jobs properly. You had all these deadlines that you had to meet. There were all these events you had to organize. So, for instance, social events, so that teaches you like organizing events. Then you had actually organizing things within the dental school itself. So we had student liaison committee meetings with the staff. The one thing about being Dental Society president at Barts is that you're not just involved in extracurricular stuff. You're actually involved within the dental school itself and the education of the students. So you had to take the feedback from the students as to what they think could improve on the course, what they felt like was missing, and you had to relay that to the staff in a way that was digestible and they actually could action these points, and you had to chase people up, and it was a difficult time, but I learned a lot in that process. And I think the biggest thing I learned was delegation. Yeah, sometimes you want to take on all the responsibility of everything, but actually if you delegate tasks well and people can see the vision as to what you want to achieve and they can buy in on the vision, then guess what, they're going to do an amazing job. But if you try and be selfish and you think, I'm going to be a control freak and I'm going to do everything myself, you're going to burn out very quickly and you won't do a good job. Yeah, you know, they say teamwork makes the dream work.
Yeah.
I'll just one thing to add. The same is true when you're in practice. I always think you're only as good as your weakest member in a dental practice. So that means your reception staff. Remember, they're the ones booking in your patients. Yeah, they're the ones who take the calls, you know, to triage these patients, and they decide whose diary they're booked in with. And then you've got your nursing staff. You know, if your nurse is really slow, they're not prepared, you could be the best clinical dentist, but nothing's ready, and there's always going to be a stop-start. And I remember when I completed the Chris Orr course, which we can talk about after, one thing that stuck with me, Chris Orr said that private dentistry is not just you doing amazing clinical work. It's the process itself. It needs to be very streamlined for the patient. It's an experience from the second they step into the practice. So that means the smells, the welcoming from the staff, when they're in the chair, everything is seamless. That's what they're paying for, in addition to the good quality dentistry.
Yeah. And do you think that lack of ability to delegate is because we're in a profession that focuses so much on ourselves and our own hands-on skills? Yeah,
we've become I think as a nation we've become very selfish. We've always think, what's in my best interests, and the reality is you just have to have belief in other people and show them that you have that belief in them, and you'll be surprised, like when you give them that belief and you give them the responsibility, they shine. Especially if they're dentists and they're dental students. Like, they're all like A-star students. I'm sure they're very capable.
Yeah, definitely. Now, I want to ask you more about the transition from dental school to practice, because I mean, you can tell the audience a little bit more about your journey into private practice now as well, working at some of the best clinics in the UK. What was that like?
The biggest shock for me when I finished dental school was there's no curriculum. Yeah. Once you leave, there's no one there telling you, oh, you've got an exam in 3 months' time on oral surgery or endodontics. So it's kind of like you have to forge your own curriculum based on your needs. So you have to have a really good, like they call it metacognition, where you realize like what do I need to improve on? What are my strengths? What are my weaknesses? But also you have to reflect upon which type of practice you're in. I don't know if you guys have heard of just-in-time versus just-in-case information.
Yeah,
You never heard of this?
Yeah.
So just-in-case information is like where you study, let's say you study implants. You learn all about implants, but you never implement it because you're not in an environment where you can implement it. So it's what they call just-in-case, because you're saying, oh, one day I might need it. But just-in-time information is information that you need right now, because of the challenges that you're experiencing within your practice or hospital, wherever it is, which you can apply right away. So for instance, you might be in an NHS practice, which a lot of us are in initially, because you're a foundation dentist. So you might be doing a lot of dentures like I was. So at that time, it's kind of silly for me to go and learn about complex root canal treatments if all I'm doing, or a lot of the cases that I'm treating are denture cases. So that's the type of information that you need to go and study and really do maybe some courses on and read some textbooks about. Now you've got ChatGPT. It'll give you a good summary of any topic, and it'll give you links to like videos and everything. Like it's incredible.
That's interesting. Yeah, that's interesting you mentioned that, because I feel like there's a lot of this almost shiny object syndrome. It's like when you, and I know I've been victim to it as well, because when I see a lot of amazing composite cases and these implant cases, and it's almost like I want to really learn about this, but then when you really sit back and think about it, it's like, when am I going to implement this? I mean, how does someone navigate learning the information that they're really passionate about versus what they really need at this moment in time?
I think ultimately you could be very passionate about something, but if you don't have the cases to implement it, like it's wasted passion in some ways. But I do believe that you can bring those cases to yourself as well. And what I mean by that is find a practice where you can do those fancy composites, instead of like when you're researching, be methodical, be purposeful. Don't just say, oh, this practice looks good, so I'm just going to go there. No, aim high. That's one thing that I would advise a lot of young dentists is, don't sell yourself short, believe in yourself and have confidence. Because I remember when I applied to be at George's practice, I thought there's no way he's going to accept me. And even Thomas Taha, who I work with in Oxford, I was going through a rough time. I was working 2 days a week in a mixed practice at the time, because I didn't want to compromise on what type of practice I wanted to be in and the type of dentistry that I wanted to be producing. And I remember Thomas, I was 2 years out of dental school at this time. Thomas just put an advert on Instagram that this is a once in a lifetime opportunity to be one of his apprentices or associates. And I thought, oh my God, I'm working 2 days a week. I might as well just apply. If you don't apply, there's no chance you're ever getting the role. I thought, even if there's a 0.00001% chance of getting this, I'm going to apply. I sent my portfolio and my CV to him. Within 5 minutes, he replied to my email. He's like, when can you come down for shadowing? And I thought, wow, oh my goodness, this is insane. So I went down to shadow a few times, and interestingly enough, I went down to shadow 2 times. And by the end of the second visit, he told me, listen, you're too young. You're not ready yet. And he told me, you need to do some more courses, and you're on the right trajectory, but the role's not for you now. Okay. And then I was so heartbroken, because I thought we were getting along, and I genuinely thought I was going to get the job after meeting him and after shadowing him a few times. So I went away for a year, And at this time, I never had the job with George. I never landed the role because he hadn't advertised for it. Then suddenly, George advertised for a job at Direct Dental in Wandsworth. And again, similar situation. I thought, I probably won't get in. Let me apply. You never know. And I was trying to be sneaky. George, if you hear this, now you know. Yeah, I was tagging him sometimes in some of my posts. I hope no young dentists start tagging George and he gets spammed.
The secret is out.
But whenever I thought I did a good case, I would tag George in it, and he would comment sometimes on my post, and he'd say, "Great work," or like, "Very tough case." And he's really nice like that. He does that with a lot of people. And I thought, you know what? Like, I've got his attention. And now it's just a matter of just proving that I am the right candidate for the job. Kind of like The Apprentice, if you guys if you guys watched that. Yeah. The finals this week, actually. Yeah. But anyhow, so I sent him my portfolio, my CV. And he had advertised for the job a few times before, like whenever there was a role that cropped up. Never responds to me. Never. Every time I send it via email, I don't get a response for months. This time, when I sent the portfolio a week later, he told me, "Hey, we should have an interview." And we did one online, and then he met me in person. And I still remember the job interview I had with George I learned a lot from it in the sense that he didn't have a formal interview with me. Kind of like how, we're sat across a desk and he's asking you all these questions. Mm-hmm. He brought his dog. He brought Tagli with him. And he told me, "Hey, Tagli needs a walk. Why don't we go to the park?" And it was nice. It was summertime. So we just went to the park and we just, we were walking around the park and he was just asking me questions, getting to know me. Getting to know a little bit about my mindset, what type of clinical experience I had. And I really appreciated it because he didn't formalize it. And he wanted to know who you are. Because sometimes if you have a formal interview with someone, you're anxious and you can't really show your true self. So after walking for like 5 minutes, I was like relaxed and I could really be me. And then at the end, he told me, "Okay, like, I'll get back to you." Then he gave me the job and I started at Direct Dental. And then interestingly, after I'd been at Direct Dental for like 5 months, I get an email randomly. And who emails me? Thomas Taha. Yeah, he emails me and he says, out of nowhere, out of the blue. A year earlier, I got rejected, essentially. He told me, "Are you still looking for an associate role?" And I was like, "Yeah, of course." I couldn't really take on the days, but I was like, because I was doing like 2 days in another place, 2 days somewhere else. So it's literally working like 4 or 5 days a week. I thought, I'll find a way. I'll find a way to do this. And so he emailed me out the blue. I went again to shadow. I think I went once or twice. And then he told me, "Look, there's a role for you here if you want it." And I was like, "Oh my goodness, this is incredible." Yeah. Because had I taken on the role with Thomas the first time, I probably wouldn't have got the job with George. I probably wouldn't have applied for that. And it's funny how the world works and how things work. And so it all worked out for the best in the end.
You mentioned a few things there I think would be really useful, especially for young dentists. One of the things is when you applied, tagging portfolios and sending CVs. Like, what does that actually entail? How do you craft a portfolio or a CV to make it stand out?
Yeah. I think with a portfolio, the worst thing when you look at a portfolio is if it's just filled with writing. Yeah. No one wants to see text. You have to remember these practice principals are busy people. Like I see what George does. He's so busy. He's got so many things on his plate. He's got social media. He's got the practices. Same with Thomas. He's got his practice. He's got the staff, etc. They want to see photos. I think they want to see photos because the photo speaks 1,000 words. So for instance, I had photos in my portfolio of me with like awards, just hanging them up like this, holding them in my hands. That speaks a lot more than just having lists, yeah? Or like your clinical dentistry. I I remember there's a really nice dentist who I learned a lot from as well. You may have heard of. His name's Payman Subhani.
Yeah.
Yeah, Dr. Payman Smiles. And I remember he would tell me that, look, when someone applies for a job with me, one of the first things I look at is just presentation of photos. It says a lot about you. You know, that they're all, equally sized and, everything's framed correctly. No one wants to see like an inflated image and then a small image next to it, etc. So just, it's the details that count because it says a lot about you as an individual. And so, and even your photographs, the quality of the photographs. So invest in a good camera. For any young dentist, that is the first thing you should buy. A camera and a good set of loupes. The first thing you should buy.
How early are you talking?
From FD. I had a camera back when I was a dental student. That's how early I had it. But I remember in the summer from 5th year to FD, I had my camera with me, and I even bought like the occlusal mirrors and all that sort of stuff. And I was practicing on my dad at home. I was like to him, come, and he was like, oh, I don't want you to practice on me. And I would force him. I was like, no, I really need to do this. And I remember from day one in my FD practice, I was taking photos of most of my cases for reflection, but also because I knew where I wanted to go. I knew I wanted to be in private dentistry. I wanted to be in a private practice, and I wanted to, because ultimately it gives you freedom to do whatever type of cases you want. I think sometimes with the NHS system, you have to work within the confines of the system. And I realized early that if I don't have these photos to show off my work, it's like it never happened. You could be the best clinical dentist, but if you can't show it to people, no one knows about it. And this is where social media comes in. That's why you have to be present on social media. Otherwise, you're almost like a ghost.
This message has been brought to you by Colgate. Now, you already know Colgate for their toothpaste and oral care, but what you may not know them for is the massive amount of support that they provide dental professionals, helping educate and empower the next generation of dentists to boost their career. Now, as dentists, we all know the importance of CPD in developing clinically. The recently launched Professional Education Hub by Colgate is a centralized platform and one-stop shop for all things verifiable ECPD related. Filled with bite-sized videos, webinars, articles, and more. From leading clinicians, you can develop your career and obtain verifiable ECPD from the comfort of your screen. The amount of value is insane. With an ever-expanding catalogue of content to choose from, there's something for everyone. Visit www.colgateprofessional.co.uk to sign up and register now. And now, back to the episode.
So right there, it sounds like you had an incredible journey from pharmacy, dental school, president, all these highs, right? Talk through the low times. What you say some difficult moments have been on that journey so far?
Yeah, good, very good question. I think the biggest lows are, remember what I told you earlier about not having a job, 5 days a week at certain times in my career, where I was working like 2 days, 3 days. And in some of these practices, I didn't have a busy list. I was in a private practice where I was maybe seeing like 2-3 patients a day, sometimes no patients a day.
Oh, dear.
And it's like, you just have to see the light at the end of the tunnel. And what I did at the time to try and circumvent this was I focused on other things, focused on like my health. I focused more on making the most of every opportunity I had with the patient. So if I had one patient booked in, guess what? I'm going to give them the best consultation of their life. I'm going to take my time, whether it's an hour, hour and a half. I'm going to take photos, clinical photos, ortho photos, scan, talk through every tooth, really go in detail on the treatment plans. And now with the benefit of hindsight, it was actually really good for me because what do you guys think is the most important skill in dentistry?
Communication.
Yes. Yeah.
We had Dr. Sorab on at an event we had over Friday, and he did the exact same thing.
Yeah. And then after communication, what do you think is the second most important skill in dentistry?
I'll let you do the second one.
Put me on the spot here. I'm not sure. Clinical?
Treatment planning.
Okay.
Yeah. So communication is so important because if you can communicate with patients clearly and you know what you're saying, then guess what? They're going to do all that treatment, the clinical dentistry side, okay? But if you can't build trust with the patient, you can't build rapport, you'll never do those fancy composites. You'll never do those fancy onlays that you see online, or, you know, whatever type of dentistry you'd like to do. But at the same time, you also have to know how to treatment plan patients, because the treatment plan is essentially your plan, right? It's what you're going to do, and you have to make sure that it's correct. And that's where you need mentors, and you need people who are going to guide you and have more experience than you when it comes to treatment planning. And I'm not going to say I'm perfect at treatment planning now. I'd like to think I'm good at basic treatment planning, but there's still a lot to learn. And even your entire career is it's a learning process. You know, there's always something you could improve on, and there's always a higher level to what you're operating at right now. Yeah.
And I guess alongside working in such prestigious private practices, there must come a lot of expectations as well.
Yeah.
I mean, has there been a time that you ever felt that you had your head in your hands and you were like, what's happened here?
Many times.
Yeah.
Many times. So the practice I work in Oxford with Thomas, he actually has a treatment coordinator. Her name's Carla. She's been in dentistry for over 20 years. She's incredible. She's seen it all. She's worked with some of the best, worked with specialists. She's worked with Thomas hundreds of times. She's even like been through GDC stuff. She knows almost every aspect of dentistry. Clinically, she's probably better than some dentists. Genuinely, like reading radiographs, treatment planning. And when I started, and even till this day, she would come into my consultations and just sit there and just listen in on the consults and just make notes. And then at the end of every consult, she'd give me feedback. She'd say, okay, you did this well. You did this poorly. And you need to improve here and there. And that, I would say, has been one of the best experiences for me in terms of my development. Because ultimately, remember what we said, communication is the most important skill. But there have been times where, you know, when you have a pair of eyes watching you as you're doing a consultation, you almost start second guessing yourself. And there have been times where I've second guessed myself with some of these patients, and then I start to fumble, and I become anxious. And I remember this one patient, he had loads going on. He had just like so much tooth wear. He had a lot of failing restorations, and he'd been to a previous dentist who said, there's nothing wrong with you. And I asked him, when was your last checkup? And he said, like 6 months ago. Then he comes to me and I'm giving him this massive treatment plan. And the patient's like, I'm a little bit confused because I had a checkup 6 months ago and the dentist said there's nothing wrong with me. And now you're telling me I've got all these problems. And at the time, I didn't know how to, you know, weasel my way out of that situation or communicate with the patient in a way that was effective enough for him to see that he did actually need all that treatment. And I literally crumbled. Like, I was literally like lost for words. I was like, oh, I don't know what to say. Luckily, I saved it at the last minute. I just told him, look, I'm going to look through the treatment plan again. And then we'll book you in for a review appointment in like a week's time. And then we can talk through it further. That gave me some time to just gather my thoughts, talk to someone like Thomas, talk to George and these type of people, and just see how they would approach a situation like that. I think now with the benefit of hindsight, as a dentist, all you could do is just communicate what's there, show the patient, don't just tell them. So take photos or scan and show them the decay. Because it's objective, it objectifies things. Otherwise, it's almost like subjective. It's kind of like you with Pearl, you know, like you do all that Pearl stuff. It shows you the bone loss. It shows you exactly what's going on. And the patients, once it's objectified, you're almost out of the situation. And then they can trust you more.
One thing that you mentioned there as well was that going to mentors and going to people like George and Thomas to walk through cases with you and get that help. Actually, I spoke to George at BDSA and he spoke of you quite highly. He mentioned one of the things he mentioned was that you take criticism really well, and look at it positively and take growth from it. How important is that as a young clinician to take on board criticism?
Yeah, that's very kind of him. I really appreciate that, George. I would say that the biggest hindrance to people's development is their egos. Yeah, it's having a big ego, feeling like I'm the man or I'm the woman, as it were. And in dentistry, honestly, you need to park your ego at the door. Leave it at the door. Go into the dental practice. Be humble, and be ready to take on any criticism, or any feedback, whether positive or negative. And if someone gives you negative criticism or tries to guide you in a certain way and you disagree, I'm sure there's some truth to whatever they're saying. So you have to try and see the benefit in it for you in the long term. Like I always tell people, you should shadow the people that work with you. Like if you work in a dental practice, and I did this during the time when I didn't have many patients. Mm-hmm. When I had free slots, I'd ask the dentist next door, they're seeing a patient, knock on the door. Do you mind if I just shadow you? I want to learn. And you might think you're better than that dentist clinically. But the truth is, no one's better than anyone else. There are certain aspects of you as a dentist that you might be more skilled at, but I'm sure there are things that they're better than you at. Mm. And you should go in there with a humble mindset and think there's definitely something I can learn from this experience. And they even say, if you can't learn something positive, you can see what not to do. Mm-hmm. If they're doing something that's not so great. So if their posture's like this, you think, okay, maybe I shouldn't do that. Because it almost gives you like a mirror of yourself. And then you start to see what you look like if you're doing all this stuff, or how to communicate with patients. Like I know, I won't quote dentists who I've shadowed in my own practices, but I've learned a lot just shadowing other people, and they know who they are. At George's practice, I've shadowed Thomas a lot of times, and every time I've learned something. Every time, even if it's just one small thing, the one thing you'll realize is when you're in practice, you're a dentist, so you know what you're doing. But it could be that one little golden nugget that just changes things for you and makes them just a little bit easier.
So you mentioned the golden nuggets, Ameen, right? Talk us through some of the golden nuggets you've had in your career journey so far.
Oh, good question. Very good question. I would say clinical or non-clinical?
Either.
I think
let's do non-clinical first.
Okay, so as in communication?
Yeah,
talk about communication.
Yeah. It can be
so one of the best things that I ever learned was when it comes to treatment planning. If a patient comes in and they have loads of treatment that needs doing, don't just present that entire treatment plan onto them, because that could be very overwhelming. Okay, I like to present 2 to 3 treatment plans. Okay, I'll break it down into, this is urgent stuff. This is stuff we really need to sort out now. Because if we don't, then what's going to happen is you might have an emergency in the near future. So if there's a fractured tooth, there's an abscess, something like that, we really need to address that right now. Then I make a second treatment plan of things that could become problematic in the future. So if they have small carious lesions, if you see a few cracks in the teeth, these are things that we really need to address at some point, but they're not urgent per se. And then you can give them a treatment plan of the optimal. This is what I wish you would consider doing. Like the aesthetic stuff, the veneers, the whitening, the bonding. And actually, when you break it down like that, you'll get more conversions for your patients, especially if you work in private practice. The patients appreciate it more because they really know, okay, this I have to do. And that might not be very expensive as well, the bits that they really have to do. But if you present the entire treatment plan, you tell them, oh, you need orthodontics and you need this tooth out and you need root canal on this. And next thing you know, you're presenting them with a 10K treatment plan plus. They're just going to be overwhelmed and they're not going to do any of it. And actually, once you've done that urgent treatment and they see that you're you're genuinely a good dentist and you care about them, guess what? They'll do all the others with you in time. But you also need to stay out of practice long enough for that to happen as well. So that's my
non-clinical tip.
yeah, that's my non-clinical tip for you
clinical?
guys. I'd say a clinical tip. It's a tough one because there's so many, right? But the one thing that I remember George told me, because I asked him a similar question, and he said 90% of patients need ortho. Yeah, or more. Yeah,
Wow.
yeah. For your work to last, if you're really serious about taking pride in your dentistry, the bite needs to be in the right position. The occlusion needs to be correct before you start doing all your build-ups and your veneers and stuff like that. It's very rare that you have a patient, not very rare, but unless they've had ortho in the past, where they have the right overjet and the overbite and the occlusion is right for you to do the type of dentistry you want to do. So yeah, majority of patients need ortho.
And how would you say a young dentist can go about understanding occlusion? Because you're not taught much about it in dental school, right? To the level you might need it.
Yeah. Honestly, I would say I personally didn't know or really understand occlusion until I went on the Chris Orr course.
Talk to us about how is that like?
Yeah, that was an amazing course. Chris Orr is one of the best educators you'll ever come across in dentistry. He's been doing that course for over 20 years now. And he had his 20-year anniversary like last year. And so he's really streamlined all the theory that he covers on that course. Covers occlusion, covers whitening, covers microabrasion, icon, specialist interface, porcelain veneers, composite, posterior and anterior. So it's a really good course for any young dentist who wants to have a foundation in aesthetic dentistry and occlusion just after dental school. And he really does simplify occlusion a lot. And he almost breaks it down into like very tangible points. And I think if I could give you a summary of occlusion, there are 5 things. Maybe I could give you 5 things that you guys would help you. Have you guys covered any occlusion yet?
I'm doing occlusion like right now.
Yeah, okay. Yeah. So with occlusion, generally you aim for canine guidance or group function, but generally canine guidance, if you guys know what that is.
Yep.
Okay, so on excursions, every tooth in the mouth should ideally have what we call MIP contact. So in the textbooks, you'll say a tripod, you need 3 contacts per tooth. But in reality, if you have 1, that's enough. They also call it a holding contact because that's what holds the position of the teeth. So that's one thing to bear in mind. The forces are greater at the back. So these contacts should be heavier on the back teeth than they are on the front teeth. You want an overjet and an overbite of normal values. And then in protrusion, so when your teeth come forward, you want your back teeth to not touch and your front teeth to be guiding the occlusion. Yeah. That's really it. Honestly, that is a summary of occlusion. Yeah. Now, how you get there for every case is a whole different story. Yeah.
Yeah, it's interesting.
How you plan that. Yeah.
It's interesting because whenever I look at, for example, your cases that you post online, what stands out a lot is the aesthetics, is the morphology and everything. But really, that's the functional stuff that matters most, right?
Yeah. That's the thing. Like, I went through a phase. I was doing these fancy composites. When I was in FD, I'd practice on models. Like in my spare time, in my FD practice, if I never had patients booked in, I'd just practice on models or extracted teeth. And then I'd go and do it in the mouth without analyzing the occlusion before. And then I'd do this amazing composites. And then I get the patient to bite down and they're like, oh my God, this is so high. Even with LA, they could tell it's so high. So I'm there trimming it all down. I'm like, oh my goodness. So, but over time, as you learn occlusion and you know how to assess it thoroughly, you can do morphological restorations that are anatomical. But you need to know how to carve them in a way such that the occlusion isn't off essentially at the end. Yeah.
And a big part there is also going on courses to continuously learn. How big were courses in your progression, and what should be the young dentist perspective on courses? What should they prioritize?
I think obviously courses are essential. If you don't do courses, you're falling behind. And within the first 5 years of your dental practice, you have to remember you're almost like a blank slate. And what you do regularly in practice is going to become habit. So you want to instill the right habits from day one. I always thought about this from day one. I remember as a foundation dentist, I thought, I want to use rubber dam from day one. Because I remember I told you about Payman Sapani, his older brother, who's not as known, but he's an incredible dentist. One of the best I've ever seen. Omid Sapani. He was my mum's dentist. And he's still my mum's dentist. I still was my mum's comfortable with him. Yeah. I asked him for advice and he told me, use rubber dam from day one. That was his advice. And he said, whatever you do in the mouth, it doesn't matter what's going on in the whole mouth, per se. Wherever you visit, make sure it's better off because you were there. Okay? So that always stuck with me. And I thought, okay, from day one, I want to practice the best type of dentistry. I'm going to be terrible at it initially. My first rubber dam was so bad. I still remember the patient was looking at me like, and it was an NHS practice, as an FD. They're not used to having someone place rubber dam. And I'm there faffing for like 30 minutes trying to put rubber dam on. In the end, they got up and they were literally like, what is this guy doing? They thought I was so terrible at dentistry, which I was, of course. Yeah. But going on the courses to be able to set the right foundations for your clinical practice from day one is super important. And talking to mentors, they always tell me, look, find who are the best at a particular discipline, go learn from them, and then implement it. So if it comes to rubber dam, find who you think is the best, and then implement whatever you've learned from them. Composites, go find who you think is the best, and implement that.
Yeah. One of the challenges that young dentists might face, especially in NHS practice, is just the time, right? Yeah. They go on courses and they learn the techniques, but they don't have the time, as you said, with the rubber dam to implement it in practice. How do they go about navigating that?
So as a foundation dentist, that's where you really need to utilize your foundation here. You should have the time because you're learning. And so your ES, your educational supervisor, should appreciate that you want to do good quality dentistry. So you want to use rubber dam, you want to do like gold standard dentistry, and they should be on board with that. Now, once you're actually an associate, that's a whole different story. Once you're an associate, you have to be profitable for the practice. Like ultimately, the principals need to make money. You can't be operating at a loss, because you're just gonna get fired ultimately, or you're just gonna pee a lot of people off. So, my suggestion would be in that regard is, and the person who told me this was Celine. I don't know if you know Celine Higton. If you've heard of Celine, she would say, because she worked in a mixed practice for a long time, and she said, speak to your principal. Actually, she said this, find a case where you want to do these fancy composites, or you want to do like some really good work, and you want to do perfect isolation. Find that one case, and it's a nice patient. Maybe speak to your principal, tell them, look, I'm going to see all these patients earlier in the day, that I'm going to book a reasonable amount of time so that I'm profitable for the practice, etc. I'm meeting my UDA targets and gross targets. But I have this one case at the end of the day where I want to book a little bit longer, maybe an hour and a half, 2 hours, whatever it is. And I want to do like the best type of dentistry for them. And you could charge them privately if it's a composite, that sort of stuff. And that will give you the experience, okay? If you're in a mixed practice. If you can find a private practice, even better. But building a list, that becomes a whole different story.
So how do you build a list? Is that your responsibility as an associate, or who's responsible for that?
So it goes two ways. The practice's responsibility is to bring you patients. Their responsibility is to introduce you to a patient. But once the patient's in the chair, Now it's your responsibility. You have to be the one who can convince that patient to go ahead with treatment. And remember what I told you guys earlier about urgent and then compromised treatment and then optimal treatment. Don't throw the optimal stuff at them from day one. Try and treat something which they need, ultimately the patient needs, and you are working in their best interests, and then build that rapport. And then hopefully you have a sustainable flow of patients after that. Because if you see one, initially you might start with 1 or 2 patients, then you can build a list. They tell their friends, they tell their family. Word of mouth is still the best way to get patients. If you give a patient a 5-star experience, they're going to tell everyone about it. Mm-hmm. Not every patient, but a lot of patients will. They'll say, oh, this dentist was incredible. You don't know what they did. They were taking photos during my treatment. And I tend to show them, I tend to send them before and afters as well. Like I'll take a photo of the tooth before, the decay, and then I'll send them like the final restorations and whatnot. The other thing you could do is social media, but it can be a bit hit and miss. It's good in the sense that it can introduce patients to you, but sometimes the patients that come from social media, they're expecting, sometimes they have false expectations, or they're just difficult to deal with. Sometimes like body dysmorphia and all this sort of stuff. You know, they come in and it's like the most minor thing they want to change. And it's like, you think, do you really need that? Do you really need that treatment? And it's like, no, they make such a big deal of something that's so small. Yeah. And sometimes even when you make that correction for them, they're still not happy. So yeah, it can be tough.
So can you turn those patients away, or what's the best way to deal with that as a young clinician?
In private practice, technically you can. You can be like, well, I don't think I'm the right person for you. I don't think I can meet your expectations. But obviously say it in a nice way. And just say, I think you'd be better off with a more experienced clinician. And then you don't necessarily have to recommend one. You just get rid of them. But sometimes the problem is you can't see that. You can't see the problematic patients. And it can be, just from a consultation, you may not gather that this patient's going to be problematic. With experience, you have a keener eye and you can spot the red flags a lot sooner. But yeah, it's tough as a young dentist. Sadly, you're gonna have to go through some.
You're gonna get burnt a few times.
Yeah, you're gonna have to. Yeah, and even till this day, I still get burnt sometimes. Ask any dentist, even super experienced ones, they still get burnt sometimes, and they still get caught sometimes. And it's always the patients you don't expect sometimes. Yeah.
Have you ever treated a dentist?
Have I ever treated a dentist? Ooh, good question. Not that I can remember off the top of my head.
Yeah.
But I know a lot of my friends wouldn't mind coming to have dentistry done with me. Maybe when their teeth start failing. The problem is a lot of the dentists that I know have decent teeth, or they look after their teeth.
Yeah, makes sense. You'd expect so, right?
Yeah.
So Dr. Ameen, you work in private practice, it's a different one to NHS. I mean, how valuable can the treatment you provide actually be in private practice?
What do you mean? In what sense?
How much value can you provide to a patient in private practice?
So the good thing about private practice is that you can use the best materials. You can use the best workflows. You can actually do what the patient genuinely needs. You could do things like ortho. You can do, you have access to like certain ceramics that you might not have access to in NHS practice. You have to remember, NHS practice is primarily concerned with health. You want to make sure that patient's mouth is just healthy. You're not concerned with how it looks per se. You can't do things like whitening. You can't do things like nice composites, veneers. And the problem is, people underestimate how much of a psychological impact even a small aesthetic improvement can have on a patient. That's still part of health. If you're psychologically being affected by the way your teeth look, then that's going to affect your mental state, and that's part of health. Has there
been a time where you've had a case where a patient's been so emotional after you've helped them?
Yeah, I've had that a few times.
Could you tell us about a time?
So I remember I had a patient come in who had these big gaps between her teeth. She couldn't afford ortho, and she had these really small teeth. They were literally like rectangles, and she just literally told me, I don't have money for orthodontics. I only have money for a bit of whitening and some composite. So I tried my best to just whiten her teeth and close the gaps with composite as best I could. And thankfully, we got a good clinical outcome at the end. And she was like, just like crying, just over the moon.
Mm-hmm.
Now, that doesn't happen with every case. That you see that a lot on Instagram, but in reality, it rarely happens.
Mm-hmm.
But I remember feeling like very, like the point we made earlier, just being grateful for having this responsibility as a dentist, that we are in a position where we can help people, and we could help them in ways that maybe we may not have been able to if we weren't dentists.
And people overlook that about private practice as well, right? The impact that you can give.
Yeah. Everyone thinks about private practice as like glitz and glamour and, money and driving Ferraris and all this sort of stuff. But the truth is, if you want to be a good associate, you have to reinvest. And even the money that you make, it goes back into courses. It goes back into maybe buying some of your own materials. You have to invest in yourself if you want to be that great clinician. So it becomes almost like a cycle. Mm-hmm. You might save a bit of money on the side. That's really it. But you're not going to be like a multi-millionaire.
So no Ferrari yet?
No, there's definitely no Ferrari yet. Definitely not. I wouldn't even want one if I could have one.
Yeah.
I think driving a Ferrari in London's asking for problems. Yeah.
Then off the back of it, I mean, you have to drink first. Off the back of that, maybe something to think about when you have that sip is, what does success look like for you? Given your highs, your lows, what is success to you now?
It's a good and complex question. I think ultimately it varies from one individual to the next.
For
me personally, I think as long as I'm ethical, I'm a good person, or I feel like is being a good person, and I'm honest with people, I'm honest with my patients, and I'm practicing whatever I'm doing in life to the highest level, and really trying to maximize the opportunities that are given to me in life, and being a good son, family member, and just making the most of every opportunity and being present in the moment. That for me, like when I come to my deathbed, I'm a happy man. I don't ask for much. I don't care about how much I have in my bank account or anything like that. It's nice to have money. It's nice to. I don't care about fame. I don't care about status, that sort of stuff. It's just like, it's the connections you make with people that really count. And because they've even proven it. Like people when they're at their deathbed, they don't say, "Oh, I wish I bought this Ferrari," or "I wish I bought this house," or "I did that." They just say, "I wish I spent more time with my family. I wish I didn't say that thing to that person." And just being in control of who I am as well. Like if I get angry, just being able to control it. I think that's a successful person as well. It's not just, sometimes people think of success as being mean, and you have to be cutthroat, and you have to be, you have to have all this business acumen and stuff like that. That really does, it can get you places, but it also creates a lot of enemies. And some people are still not going to like you either way, but the ones that are genuine and the ones that are good people as well, they'll see that, and they'll see your good heart. Hopefully, for me, that's.
So, would you say then, Dr. Ameen, that you can measure your success by how easily you sleep at night?
Yeah, essentially, yeah. I want to sleep at night thinking I haven't oppressed anyone, I haven't hurt anyone in some shape or form. The patients that I have, I've treated them in the best way I can. And I always think to myself, even when it comes to dentistry, I think I want to be the dentist that I would want to see as a patient, in the sense that even the bits I can't see, whatever they're doing in my mouth, that's being done to the highest level and in an honest way, and they're genuine with me, and they're not hiding things from me. And with my family, just being a good son and a good family member, as it were.
Awesome. Listen, guys, I've been Afif.
I've been Fahim.
This has been a Young Dentist. Thank you very much, Dr. Ameen. A really good episode.
Amazing.
My pleasure.
Awesome.
Thank you, guys.
Cut.